Good day, everyone. I am Madeline Square, student nurse from Nicol University Polanyi campus, and today this is my return demonstration on application and hot water bag. So let's go! So for the assessment, I will assess for the doctor's order as well as assess for the specific area for the application of hot water bag. So according to the doctor's order, I will be putting a hot water bag within the hands of the patient due to swelling for about 15 to 20 minutes. Also, we'll assess for the specific areas for the application. As I assess for the specific area for the application of hot water bag, I will do hand washing as well as prepare for the equipment. I will do a hand rub before preparing for the equipment. Now that my hands are clean, I will now get ready or prepare for the equipment.
Let's prepare for the equipment. Here we have 2 towels, a hot water bag, a bath thermometer for measuring the temperature of the hot water, an alcohol for hand hygiene, clean gloves, and of course, a pitcher of hot water. Before preparing for the equipment, let's put some clean gloves. I already do the hand rub. Now that I put my clean gloves, let's start preparing for the equipment. These 2 towels, I will utilize this 1 towel for any leakages. This is a hot compress bag or hot water bag. And let's put a little of water to measure for any leakages within the hot water bag. Let's seal tight the hot water bag. And let's test it out. There is no leakages. Then let's test for the temperature of the hot water. I use a bath thermometer. The water is in appropriate temperature. Now, let's fill the bag 1/2 to 2/3 with hot water at 46 degrees Celsius. And also squeeze for excess water and secure with stopper tightly. Now that the hot water bag is tightly sealed, let's test for any leakage. There is no leakage. Now we will pat dry the hot water bag for any excess water outside the bag. And let's disregard this towel. We will use another towel to cover this hot water bag. This will utilize to the application to the swollen part. This towel ensures that the patient doesn't directly touch the hot water bag and prevents any burns. Now that the hot water bag is ready for application, let's go!
So now that I've prepared the equipment as well as perform hand hygiene and wear some clean gloves, I will now start for the implementation. I will introduce myself, identify the client's identity, and provide privacy as well. So, good afternoon po ma'am. Ako po si Madeline Escobar, student nurse po mula sa Bicol University Pulangi Campus. Can you state your full name po ma'am and your birthday po? Okay po ma'am. So, today po ma'am, according po sa order ni Doc, meron po kayong pagmamaga dito po sa inyong left hand, sa inyong IV insertion area. Lagay lang po ako ng hot bag or hot compress po, madam, para po mag-subside po ang pagmamaga. Is that okay for you, ma'am? Okay. So, I will now pat the hot compress within the swollen area for about 15 to 20 minutes according to the doctor's order. So, ma'am, lagay na po ako. Sabi lang po kayo kung may naramdaman po kayong init. Okay lang po, madam, yung temperature. So, for every 5 minutes, I will check for the skin for any changes of the color, such as redness, which is an indication that the temperature of the bag is excess. Sakit po ba, ma'am? Hindi naman po. Okay po, ma'am. Nawala na po ang pagmamaga. I will now reposition the patient to her comfort position and as well as drape the patient. Okay na po, ma'am. Nasubside na po yung pagmamaga. Okay po, ma'am. May iba pa po kayong katanungan or pwede ko po i-assist sa inyo? Wala na po. So, thank you po, ma'am. Stay safe po, madam. So, next, I will clean my hands and remove my clean gloves as well as empty this bag.
Now, let's clean the hot water bag. First, let's empty the bag. Wash with soap and water. Now that the bag is clean, let's hang dry. After cleaning the bag, let's wash our hands.
As I assess the patient doesn't feel any discomfort as I place the hot water bag within the swollen area for about 15 to 20 minutes. As well as the patient doesn't has a change of skin color as I check for every 5 minutes. So for the documentation, I will record the procedure and the client's response. So this is Madeline Escobar, student nurse from Bicol University Pulangi Campus, is now signing off. Thank you for watching!